I'm Phillip Levy, Chair of the Accreditation Management Board from the Accreditation Services of the American College of Cardiology. I'm also a Professor of Emergency Medicine at Wayne State University, where I serve as Associate Chair for Research in the Department of Emergency Medicine and Assistant Vice President for Translational Science and Clinical Research Innovation. Accreditation is very important for hospitals. It helps to ensure that they adhere to guidelines and institute best practices in their care pathways. Accreditation helps to remove variation in practice, which we know is responsible for a lot of disparate outcomes. Importantly, hospitals that pursue accreditation are more likely to adhere to guidelines and more likely to have better outcomes for their patients. Accreditation is moving in several important directions. Foremost, we're continuously looking on the horizon and figuring out what offerings we can provide to our hospitals. EP Lab accreditation is one of the first ones to come. In addition to this, we are incredibly aware and cognizant of the need to reduce the data burden. We realize that hospitals are faced with a lot of data pressures, and we want to make sure that the hospitals and the service line administrators at the facilities can input the data needed for accreditation in the quickest and easiest manner possible. Highlights of this year's Congress, the 20th Congress for Cardiovascular Patient Care, really centers on the understanding that we're all part of one big family. So as part of the ACC, we now partner with the NCDR on several different fronts, and having the NCDR here this year was a big change. We haven't had them at our Congress in the past. We had a whole session dedicated to NCDR and to understanding how we can leverage data resources from NCDR to improve accreditation offerings. In addition to this, we had representation from the American Heart Association here working and talking about the AHA ACC Cardiovascular Center of Excellence program, which is something that we're both very proud of.